If someone asked you right now, what emotion are you feeling? Could you name it? Not good or bad, but the actual emotion. Because research shows that many Crohn's patients can't, and it's directly linked to worse disease outcomes. Hi, I'm Kate, and today we're talking about alexithymia, a measurable neurological pattern that makes it hard to identify and describe your own emotions. And if you have Crohn's, understanding this could change how you manage your disease. When my son was first diagnosed with Crohn's, I'd ask him how was he feeling, and he'd say fine, even when he clearly wasn't. Even when I could see something was wrong, it wasn't that he was hiding things from me. He genuinely couldn't tell me what he was feeling inside his body or his mind. I see this pattern constantly. Someone will come in with obvious stress written all over their face, and when I ask them what's going on emotionally, they'll say, I don't know, I just feel off. Or they'll jump straight to physical symptoms. My stomach hurts without being able to connect it to anything they're feeling emotionally. And here's what matters. It's not a character flaw. It isn't about being out of touch or emotionally immature. It's a measurable neurological pattern that shows up more often in people with chronic inflammatory disease, including Crohn's. So let's talk about what alexithymia actually is. The word literally means no words for feelings. It's when your brain has difficulty identifying, distinguishing, and describing your own emotional states. About 50% of people with Crohn's disease show signs of alexithymia. That's compared to about 10% in the general population. And studies show that Crohn's patients with alexithymia have worse disease outcomes, more flares, more severe symptoms, poorer response to treatment. So remember, about 50% of people with Crohn's. Now, most people assume this is just correlation, like, of course, chronic disease makes you emotionally disconnected, but the research suggests it's more complex than that. Alexithymia affects how your nervous system processes stress, and when you can't identify what you're feeling, your body still responds to that emotion, but without any conscious awareness or ability to regulate it. Think of it like this. Your emotions are data. They're information about what's happening in your environment and your body. When you can't identify an emotion, I'm feeling anxious about this deadline, you can do something about it. You can problem solve. You can use a coping strategy. You can ask for help. But when you can't identify it, the anxiety just becomes this vague, uncomfortable sensation that your nervous system interprets as a threat. And threat means inflammation. Threat means your gut-brain axis goes into protective mode. And for someone with Crohn's, that can mean a flare. So here's what actually helps. I'm going to give you 3 practical techniques adapted from acceptance and commitment therapy that help you build the skill of emotion identification. Because yes, it is a skill. It's not something you either have or you don't. It's something you can develop. Okay, technique 1. Excuse me, sorry, my nose. This is about learning to connect. Actually, there's a sensation. It's about learning to connect physical sensations with emotional states, because here's what happens with alexithymia. You feel the physical sensation, but you can't translate it into an emotional word. So we're going to build that translation skill. Set a timer on your phone for 3 times a day. When it goes off, stop what you're doing and do a quick body scan. Start at your head and move down to your toes. Notice, where is there tension, where is there tightness, where is there heaviness or lightness, or where is there an itchy nose? Then, and this is the important part, you're going to ask yourself, if this sensation had an emotion attached to it, what would it be? Not what you think you should be feeling. What does this sensation match up with? Tight chest and shallow breathing, that's often anxiety or fear. Heavy feeling in your limbs, that's often sadness or grief. Tension in your jaw or shoulders, that's anger or frustration. Hot face and racing heart could be excitement or anxiety. They can feel similar. Not sure what an itchy nose is. My son started doing this, and in 2 weeks, he could say things like, "My stomach feels tight and I think I'm anxious about my test tomorrow." That's huge. because now he could do something with that information instead of just having his body react to unnamed stress. So technique 2, the emotion wheel. If you Google emotion wheel, you'll find dozens of versions. Print one out, put it on your fridge or your bathroom mirror, or save it as your phone wallpaper. These wheels start with basic emotions in the center: mad, sad, scared, happy, disgusted, surprised, and then branch out into more specific words. So mad branches into frustrated, irritated, resentful, betrayed, furious. When you notice a physical sensation or you know something's off but you can't name it, look at the wheel. Start with the basic emotion that feels closest, then move outwards. See if a more specific word fits. It does 2 things. First, it gives you vocabulary. A lot of people with alexithymia literally don't have enough emotion words in their working memory. The wheel gives you options. Second, it makes emotion identification a practice, not a test you can fail. You're not trying to get the right answer, you're just building familiarity with the landscape of feelings. I had a client who used the emotion wheel for a month and she said, "I didn't realize there was a difference between disappointment and discouraged, but there is. And knowing which one I'm feeling changes what I need to do about it." Technique 3, the name it to tame it practice. This comes from neuroscience research by Dan Siegel. When you put words to an emotion, when you literally say out loud or write down, "I am feeling anxious," it reduces activity in the amygdala, which is your brain's threat center. Naming the emotion actually calms your nervous system. And here's how to practice it. Once a day, write down 3 things: a situation that happened, the physical sensation you noticed, your best guess at the emotion. It might look like this. Situation: my boss sent a vague email about my project. Sensation: knot in my stomach, couldn't focus. Emotion: I think this is anxiety mixed with maybe some irritation. You don't have to be right. You're not being graded. You're just practicing the act of pairing situations and sensations with emotion words. Over time, your brain gets faster at making these connections in real time. And here's what I've seen happen. When someone with Crohn starts being able to name their emotions before their body escalates into a stress response, they have fewer flares. Not 0, we're not promising that, but fewer, because they can catch the stress earlier and do something about it. My husband, who's been flare-free for 20 years, will tell you that learning to say, "I'm feeling overwhelmed and I need to step back from this situation," was just as important as any dietary changes he made, because once he could name it, he could act on it. Before that, the overwhelm would just build until his body crashed. Now, I want to be clear. These techniques don't replace medical treatment. They don't replace therapy if you need it. They're not going to cure Crohn's, but they are going to help you work with your gut-brain axis instead of against it, and that matters. So let's come back to that opening question. What emotion are you feeling right now? If you still can't name it, that's okay. That's actually the point. You're not broken. You're not emotionally stunted. You might just have a neurological pattern that makes this harder for you than it is for other people. But here's the good news. It's trainable. The body scan, the emotion wheel, the name it to tame it practice, they're not complicated. They don't take hours. They just take consistency. And when you start being able to say, "I'm feeling scared about this scan next week," or "I'm feeling frustrated that my energy isn't back yet," that's when your body can start to relax. Because you're no longer carrying unnamed threat, you're carrying information, and information you can actually work with. Now, if this helped, share it with someone who needs it. Send it to someone in your life who has Crohn's or who struggles to name what they're feeling. And if you want more support with the emotional side of managing Crohn's, that's exactly what we work on in the Crohn's Method community. I'll see you in the next video, and have a beautiful day.